Okay, good evening, friends. And I'm very happy that we are all gathered here for a completely different webinar altogether. As you know, that since the lockdown has started for last 5 months, there is a tsunami of webinars which are happening all over the country, organized by different organizations, by USI, by zonal conferences, city chapters, and the several institutes. Most of these webinars are devoted to the various issues like URS, PCNL, RIRS, CA prostate, CA bladder, and so many other academic issues. There were few webinars which were little different and devoted to a little different topic. And today we have selected a totally different topic, that is on the current affairs and issues which are actually affecting the urologist. As you know, in last 1 or 2 months time, there were lots of things which have happened which actually has affected the urologist perspective, urologist practice, and the way urologists should think forward. So we are going to take up these three issues. But before I tell the details about that, let me start sharing the screen and introduce our panelists. Well, today, because these are all discussions which we are talking on the current affairs and judgments of which are affected urologists, it is going to be a little bit legal aspect about it. And when we discuss about the legal aspects, there are only three names which will come in your mind. And we have renowned faculty today with us. They are all urologists, but they also have the in-depth knowledge of the legal issues. They are all lawyers. People come to them for the medical legal consultations, and therefore their opinion, their discussion with them is of a great relevance, especially when we are discussing the judgments, Supreme Court orders, and the various observations which they have passed out. Well, we have Dr. Lilith Shah, who is the current president of West Zone Urology Society of India. And he is well known for his in depth knowledge of legal issues. He has conducted many conferences and workshops and been the convener of various platforms of USI and zonal chapters. He has also participated in many webinars and given his opinion on the legal issues. Well, next we have Dr. Gaurang Shah, who is the Bombay Urology Society president, and he also is a very renowned urologist. And apart from the renowned urologist, he is also has the degree of the law. He is LLB by degree, and he also has in-depth knowledge. He studies a lot. He studies every aspect of the legal issues which crop in, and he has always been helpful for any problems which urologists come into and give the legal opinion. Well, we also have Dr. Sunil Joshi. He is a very renowned urologist and also has an in-depth knowledge of legal issues. Whenever legal conferences are held, whenever there is a material which is to be prepared for the from the legal point of view, he always studies a lot. He was associated with our first EuroLegaCon, and since then he has been participating in various webinars, conferences which are held on the legal issues. Well, we are very lucky that they have spared time for to participate in this webinar. And today we are going to discuss mainly three issues. One is the consent form. I will come to that in detail. The other one is that whether we are out of the Consumer Protection Act or not. What is the background of that? I also will come to that. And the third issue is about the Pandemic Act. So many things which have been discussed about the Epidemic Act, and almost nobody knows what exactly the act is, what are the implications of the act, where you can challenge it, and what are the measures in that. So let us discuss out about that. Now, let me go forward with this. The first issue we are going to take is the consent form. Why this issue is being taken up? Because if you see here that the date here mentioned is a July 9, and on this date the judgment came from the Apex Consumer Commission, NCDRC, and what they have shown is that there was a case in front of them where a party went to this commission stating that the consent which the was taken, and this was the RG Stone Clinic in Delhi, was on a printed form. Although they had a printed form, there was a few things which were written in their own language, and then the patient had signed. Now the patient went into the court stating that this is not fair. The printed form was not properly. I was not told about it. Although it was in the vernacular language, it was in the local language which patients understand. And after hearing, the commission passed the judgment that pre-printed consent form is the unfair practice. Now, what they have written is that the medical procedure unfair trade practice, saying that the pre-printed form fits in for any procedure, doctor or patient. Thus, in this case, it was arbitrariness. So this had a huge implication. In fact, they had to pay the penalty, and the penalty was charged on that. Now, this obviously has a huge amount of repercussions from all of us. So, why? What are these repercussions? As you know, that consent form almost everywhere, whether it is a corporate hospital, whether it is an individual nursing home, whether it is the charitable hospital, they are all written consent forms which are printed in different languages, which the patient understands. In fact, the Urological Society of India, based on USI, they have also prepared the consent form for various procedures. They are there on the website, and many urologists have downloaded those forms, and they are using those forms for the different procedures. Now we need to discuss it out that what exactly do we understand from this judgment. So I want to ask Dr. Lalit Shah that what exactly we understand from this judgment, because we have been under impression that once you have a printed form and once patient writes with his own handwriting, that is fair enough. But from this judgment, it appears that it is not adequate, it is not proper. So can you explain us what is the meaning of this judgment? Dr. Lalit Shah, please.
Volume is not there.
No, I just unmute himself. Yeah. Am I audible now?
Okay.
Yes,
Yeah.
yes, sir.
See,
Yes,
this judgment, I have gone through the whole judgment, and in one of the webinars, also in the medical legal webinar, the Dr. Kantikar, who was the basic architect of this judgment, was there in that particular meeting, and accordingly, whatever is my understanding, that I would like to tell you. Really. Number one, what I feel is that this particular judgment, the National Forum has gone beyond the Supreme Court judgment, which was the logical one in 2008, where the concept of Meera Kohli versus Dr. Prabha Manchanda in 2008. Whenever there is a Supreme Court judgment which says about a principle of law, like in this particular case, they have defined certain criteria, so that becomes the law of the land. And that cannot be changed by any other authority than the Supreme Court bench, which is larger than that particular bench. So in a way, this is like an over-encroachment by the National Commission on the Supreme Court judgment and the law of the land. That is what his personal feeling is, number one. And then what do we understand by this judgment? See, what they have said is very clearly, they have said that there is no medical negligence. So in my opinion, it is even in the fact of the law, in the sense that if it is a deficiency in service, that the consent is not valid, then it automatically becomes a medical negligence. So you cannot say that you cannot say that way. So actually speaking, this is not only in overriding the Supreme Court judgment over that one, and number two, it is wrong in the fact of the law. So this is a challengeable one. And then another aspect which he says is, because what they have done is, in generally there is, after every decision, whatever court that is, there is a philosophy in legal terms what they call as ratio decidency. That means you have to give the reasons for your decision. In this particular things, they have not given sufficient clarified reasons for themselves. What they
Right.
said is that the principle, this particular pre-printed form, few blanks, is the one which can be fit into any doctor, any procedure, any hospital. But that's why this is a deficiency in service,
Right. Right.
which is not proper. Another thing is that this particular aspect, normally speaking, whenever there is a judgment in all of the lower courts, it becomes the precedence, and that
Correct.
can be given as an example. This
Right.
particular, legally speaking, this particular does not fit in because number one, it is not given the reasons for it, and moreover, it is an incidental remark.
Right.
What in legal terms it is called as obiter dicta, and it does
Okay.
not fit into that also. So that cannot be and should not be taken as the precedence. But
Okay. Okay.
unfortunately, we are always afraid what happens in general, that over a period of time, and the highlight of this note remains that the pre-printed forms consent is a unfair trade.
Right. Right. I think his internet has some issue. Now, Gaurang, I want to ask you, Gaurang, I want to ask
Okay.
you
Yeah, tell me.
that, as Lalit Bhai has rightly pointed out, that actually it violates the Supreme Court judgment or the philosophy which was there in the before. So is this judgment can be challenged? Has anybody gone to court that against this judgment, or why this particular party, when he was charged, they have not gone to court, or for that matter, whether IMA or any other Mumbai Urology Society or Vezon or some other organization, can they go to court against this judgment? Is it possible?
Yeah, now there are three important things we have to understand. Number one, if you go to see the judgment, okay, then everything you see here, that the patient had gone to RG Stone and they had done his surgery. He went to different institutes. Ultimately, he's cured. And this has been established in the court. Okay. So now what
Right,
has happened, that they are not penalized, means this money has not gone to the patient,
right,
as you can see in this judgment. Okay.
okay,
So then find there is no deficiency in service or medical negligence in this case.
right,
So now what is the judgment? That judgment is that you have taken a printed form. That means what? That you can have a performer. So,
right,
but you have to fit everything into that performer. You cannot
right.
have a printed one from the beginning and then you write. That means what? You may take a signature of someone and then you can fill up later on.
Mhm.
So that is the thing. Here, but suppose if I have got a performer of PCNL, I have got a performer of URS, and I
Right,
have got to fill in the blanks. Now, when the patient comes, I will type his name, I will type in, everything, whether it is left side, right side, and then if I print it out and if I give it to the patient and he signs, there is nothing wrong in that.
So this judgment, what actually they had done was the
Yeah.
same thing, that they were filling the blanks, and the blanks were filled up by the doctor, and the patient signed it. So it amounts to same.
But this is not for the negligence for the patient. What they are saying,
Right.
that you have done a wrong, this money has not gone to the patient. The
Right.
National Forum has kept it and they are going to use it for those who are needy. So
Okay.
they have taken it in their funds, as you can see it here.
No, but what I want to understand from you
Yeah.
is that on what basis they have said that this money has to be paid to them, and they will use it for needy. Now, have they not actually crossed their limit?
Yeah, they have definitely crossed their limit, but this aspect no one has thought of any time. Like, we always think that we are penalized, the doctor or the hospital is penalized, and that money always goes to the someone who has suffered. This is the first time it has
Correct.
happened that they have kept the money and they have given the judgment that there is no negligence. The negligence, they are saying that why you have done this, and this the patient never had asked for this.
Correct.
He had asked 1 crore rupees and some 11 lakhs rupees, 1 crore 11 lakh rupees only as a compensation because he developed a complication. That is when
Right.
he developed a leak, this thing, vesico rectal fistula.
Right. So I want to one clarification from you, from the legal point of view.
Yeah,
This order is by the Delhi Consumer Commission, right?
correct.
So what is if someone wants to appeal? Is there anyone who can appeal, or is there any possibility that some other organization can go and put a public interest litigation or something like that
Yeah, we
against
can
this
go.
judgment?
What
Is
we
it
can do
possible?
as a faculty, all of us, we can go to the Supreme Court because now this will become a pretty this thing precision. So every time,
Precedent?
yeah, precedent. So every time when we someone something like this will happen, the consumer forum they will take the money from us.
Correct.
Okay.
So this is a
May, may
thing.
I may I may I come in, Ravin?
Yeah, please.
Yeah. See, as I understand, and like I said, we had a discussion in various platforms. As I understand, and I was given the impression is number one, RGA Stone is already gone for the appeal. That is number one.
They have gone to the court.
Supreme Court. Next
Supreme.
authority is Supreme Court, where they have gone for appeal.
Okay, good.
That is one. Number two is that there is an Institute of Medicine and Law. They had asked USI also to become a co-petitioner, for which they have approached me, and I, with the permission with the council and all that, have given them the go ahead for being a co-petitioner into that, and the paperwork is being done. So they would also go for a PIL. Another
Okay,
is
good.
one of the Association of Health Worker Providers of India. That is a sort of a nursing home and the corporate hospital associations all over the India. They are also planning to go ahead with the PIL, as per my understanding
Right.
is there.
So I think enough people are being activated, and the matter is it will be
Yes.
considered in the Supreme Court. And it is very likely, as you said, that it violates the principle of Supreme Court. Then it is very likely that this may get reversed.
Yes, this will get reversed.
Okay, good. I think that's a very important information which we have got from all of you, and that's a really great relief. Now, while we are on consent, now I want to ask Dr. Sunil Joshi, while we are on this topic, that when we take this consent, we always take, there are forms which are there, printed forms which are there, and then patient signs in their own local language, whatever this, and patient sign, the witness is also there. Now, what I want to ask you is that when we take, there is a lot of discussion as to what to mention and what not to mention. Now, with lots of in-depth discussion, all of you have prepared the consent forms for the PCNL, for TURP, for URS. We know it. They are there on the Wisdom website also. What I want to ask you specifically is that all these consents, what is is the video consenting required, or the signature on the form is sufficient enough? Tomorrow, can patient say that these are all printed form and I was just told to sign, and that is how I have signed? Can you go back on this consent form? Is there any camera evidence? Is there any video evidence required that he actually has signed and he cannot go back?
So as such, there is no compulsion for video recording. But if you have got a video recording consent, it will be always useful in the court of law. Second thing, whatever printed forms are there, these forms have got some blanks, as it is mentioned in NCDRC, that certain blanks are filled up, and so that it is used for any patient, any procedure by any doctor. So it can be challenged, as we have discussed just now. But the matter is that we have to go through the even at present, since the NCDRC's judgment till it is reversed, we have to follow this judgment at present, because it is a precedence right now. And
Right.
if you want to do anything pro forma in your computer or laptop, and for each and every procedure, and get a print out of that, and print out the name of the person and age and everything and address and telephone number in that same pro forma, which is having a blanks inside. And then if you get text signature, it is valid. Electronically generated consent form, which is already as good as a pre-printed form. But it is there in your computer, which is as good as a pre-printed, and you can fill up the blanks yourself and get the things printed out, and then get the signature of the patient and witness and yourself and the studies, whatever it is.
Okay, so I think that is a good idea that instead of the filling the blanks, you put the name and then take a printout so that it doesn't appear that you have filled up the form. It appears that it is a specific consent form which is meant for that particular patient for that particular surgery. So it does not appear that you have filled up the gaps and then the common form is taken.
It should be editable, so you can edit certain things and you can add or delete certain things which is already there in pro forma. So that will be useful.
I think that's a very good advice.
Another thing that we suggest, Ravin, another thing that we have always been suggesting, and in our protocol also we have suggested, and many times we say that we must get at least one line written in the patient's handwriting that we have been told about the disease, anesthesia, operation in details in our language. If one line is
Yes.
Yeah, so what Laksha is saying is right, that you ask patient, if he cannot write down, then you ask his relative to write it down.
That's all right. Yeah, doesn't matter.
And let them, both of them sign. And I will say that you should also keep someone else, apart from sister, doctor, and the patient and the relative, maybe some social worker or someone who is a neutral fellow, and he also signs. And as you are saying, video is, I think, corollary to it, means it adds the value to it, but only video will not help us.
That is true.
Right.
It will be
written document when patient is signing, like how we do for transplant. Patient is signing is that time the video is taken. So I think the message is very clear from all of you that till such time the final judgment from Supreme Court comes in, we have to respect to this judgment which has come in.
Hello.
And to overcome this problem, what we can do is that we can do take a printed form, take a print which is specific to that patient, which is specific to that particular surgery. And as Sunil Bhai rightly pointed out, that it could be editable thing, and you can add, delete. And very, very important is that even if you take this printout which is specific to that particular patient, there has to be at least one sentence written in patient's own handwriting that he has understood everything, and then he signs. Just signature may not be sufficient. It is better to write some sentence in his own handwriting that will add the value to this consent form. Is that correct?
Yeah,
absolutely.
I would like to add only 2 points. In the judgment, it is not said that printed form is not allowed. Only the fill in the blanks and writing is not allowed. That is number one. And number two, if you see about the prescriptions also, there is a judgment that now you have to write generic as well as you have to write it in a capital letter.
Right.
That someone can read it properly. So in this case, if it is a printed form, it is always welcome.
Correct.
I want to add, if you got a consent form in your computer, which is in the language, local language, it will be better. But if it is in English language, you have to take the signature by writing by the patient himself or herself, that उपरोक्त जो अनुमति पत्रक में जो कुछ चीज बताई गई है वो हमें पूरे तरह से समझाई गई है और हमने समझकर उसको साइन किया है, ऐसा हिंदी में लिखा है.
Okay. So I think that is very, very important. So that explains all the problems which were in our mind. I think you have explained to us very, very nicely and very properly about the consenting. Let us come to the second aspect which we want to discuss it out, and that is about the next slide, which I am going to tell you is this. The consumer bill draft removes the healthcare from the services. Now, let me just give a background to all the viewers who have logged in. That this if you see, the date is in the June 19th. Now, the background of this particular discussion, why this particular thing has come up, is that when the last government was there, Modi government was there before the elections, there was a bill which was put into the Rajya Sabha for the passing of this Consumer Protection Act, and there are amendments, and there were certain things which were included in that list, who are included in the under the heading of consumer. There were particular list, and there were many people in that list. Now, in that list, in 2019, the healthcare professionals were included in the list. However, during that time in the Rajya Sabha, that bill could not be passed. Subsequently, the government got dissolved, the elections were announced, new government came in, and when the new government comes in, you have to put a draft bill again. So this draft bill was to be passed again and put into Rajya Sabha. Now, when new draft bill was to be prepared in the cabinet after discussion, the list in which who were included in the Consumer Protection Act, in that list, the healthcare professionals were removed from the list, and then subsequently it was put into Rajya Sabha. Now, this became a very big news from the doctors and from the urologist point of view, that we are not included in the list of consumer who will come under Consumer Protection Act. There was a lot of jubilation, a lot of discussion came in, but subsequently it was realized that actually what it came in is far beyond, or it is far away from the reality. Actually speaking, non-inclusion in the list does not mean that we are removed from the Consumer Protection Act. Now, this created a lot of confusion. We still don't know what exactly it means. The IMA has come into the picture. A lot of people have said yes, a lot of people have said no. There is still not clarity, and therefore, this particular aspect we have kept for discussion. So, I want to first ask Dr. Gaurang Shah that what actually does it mean that not included, or somebody said it is not excluded, somebody said it is not included is not equivalent to not excluded. Now, what does it actually mean? Can you throw some light on that?
Yeah. See, if you go to see, then I can show you that earlier in 2018, when this bill came, okay,
Yes.
now you can see it here. It is given healthcare, boarding or lodging, healthcare. It was written in 2018 and it was
Right.
passed in Lok Sabha, as you said very rightly. It was not passed in Rajya Sabha.
Correct.
Now, if you go to see the new one, again, 42 on page number 7, section 42, health is not included. It was passed
Correct.
last year. So, if you compare both the thing, earlier health was there and now health is not there. So, we
Correct.
question that as far as this judgment is there, we are not included.
Correct.
At the same time, we can be challenged in civil court or in the criminal.
Correct. So that is okay.
Yeah, but not in consumer, because it is very clearly mentioned over here, and means it is not included over here.
No, but Gaurang, I want to ask you a further doubt on that. Is that when we discuss this matter with many people, and now IMA also has come out with some clarification that when they say that it is not included in the list, has actually no meaning at all. Because if you see the Consumer Protection Basic Act, which is of a 1995, where on the advice of Supreme Court, the doctors were included because they are charging the fees, and therefore they were supposed to be included under the Consumer Protection Act. That basic thing is not changed. And what people have given clarification that this health not included in the list, which is to be put in Rajya Sabha, actually is the eyewash. It does not really mean that we are out of Consumer Protection Act, and if there is any grievances, it should be tried in the civil court or a criminal court or whatever. So this is what the clarification came from some people. Now I want to ask Lalit Shah, what is your opinion on that? And then I will ask Sunil.
Yeah. I understand very clearly. What has happened is probably like the right word you have used is an eye wash. It is just like an eye wash. It has not been included. It has been removed from the so-called inclusion list, but it is not put into the exclusion list. All right.
Correct.
If you go through the original one, 1986 CPA, it was not included there. But by IMA versus VP Shanta case, Supreme Court decided that it needs to be in there in 95, 96, that it will be there. So unless until it is changed by the Supreme Court decision, it is not going to change. That is number one. Number two, I believe very strongly that there have been so many of the cases and so much of the compensation against the medical negligence that no part of the society is going to let go the doctors and the hospitals so easily out of the CPA court.
Right.
And that is very, very clear that they would not allow it to happen.
So this not included does not mean it is excluded.
It does not. Yeah, it does not mean anything practically speaking. Now, and the third point, which I forgot to tell, that is that still, to my knowledge, though this act is applicable and effective, the consumer courts are taking the cases, new cases as well. It's not that they are not taking.
Right. Dr. Sunil Doshi, you want to throw some light?
I fully agree with Dr. Lalit Bhai. Though it is not included in present this act, it is the definition of service is falling. Our healthcare is falling in that only criteria, and whatever services we are charging for is definitely falling in the Consumer Protection Act. So we are definitely under the CPA, no matter whether the services of healthcare is included or not. And as far as my knowledge, all the cases are at present taken by the Consumer Protection Act of all healthcare cases at present.
Right. So I want to ask Dr. Lalit Shah that the government, when the cabinet meeting was held, and the government decided that this time when it is put into the Rajya Sabha, healthcare will not be included. Does it mean that in future there can be some amendment because there is so much of uproar from the doctors and maybe government wants to be in good terms with doctors or something like that? Is it possible that they can be removed from this? Can they bypass what Supreme Court government has authority to make a law? So is it possible or is it in the jurisdiction of the government to exclude the healthcare workers in future, even though Supreme Court has said that you include them? Is it not the prerogative of the ultimately the parliament to decide what is the law, what is the act and what should be done? Supreme Court is only to follow the act which is prepared by parliament. They cannot decide the act. So what do you think about it?
No, Parliament definitely is supreme and they have the power to amend the things. But I, personally speaking, I feel that whatever is the eye wash, like you said, is probably a political eye wash to wash away the whatever approach or the pushovers must have been happening. In the heart of the hearts, probably nobody is willing and all the section of society are against the doctors and the medical profession. So it is not going to be very easy to happen it like this. That is my personal impression.
Right.
And until one of our community goes to the court and says, when it is not included, then we should not be taken in consumer court. Then only then we'll be able to make out whether we are included or not included.
Correct. So I think this is what has created a lot of confusion, and you are rightly pointed out that one has to get some clarification from the court itself that what is the meaning, then why was it not included when it was included in the beginning in 19? Why it is not included here? What is the meaning of it? There has to be some clarification from the court itself. So how do we ask court that you give clarification? Is it possible for someone to ask, or who has the authority to ask the court like that?
Any person can go into court of law, or even an association can also go into the court of law, even up to the Supreme Court, and PIL can be made against this thing and to clarify this thing. but till it is clarified, we fall under CPA.
Okay, okay, okay. So
See,
while
even as I understand, probably even IMA has not done anything very actively to consider also to go ahead for this, so far as my knowledge goes.
Because IMA is saying that, as you said very rightly, that it is both the criteria they have not considered for the healthcare. That is why in inclusion it is not there, but in exclusion also they have not put it. So this is little dilemma. So what to do? So unless and until like we go to the court, consume everything and say that we should not be included because of this bill, then only then we'll get a clarification.
As such, as far as this if you count in this way, that so many cases against doctors are filed in the many courts, in the lower to the Supreme Court. Most of the cases are rejected, and so many are frivolous cases are there, as far as courts have found out. So that this thing can be put into the court, that we are facing this kind of unnecessary harassment
Hello.
because of this CPA.
Good evening.
right. So
Lalit,
while on this Consumer Act, what is included, not included, Dr. Gaurang, I want to ask you that obviously the consumer, why we are included is because we charge the fees, and once you charge the fees, obviously the opposite party becomes the consumer. Now there is also a lot of confusion while we are on this issue. I want clarification from you. Is that suppose if you don't take the fees, are you liable to be tried under Consumer Protection Act? That is one. Secondly, I have seen that even the government hospital cases, I have seen this, that government hospital, if there is some problem, the patients, they are going into the consumer court, and consumer courts are accepting those cases, and they are actually putting the trial, and the government is putting the lawyers and this to plead from their point of view. Now, when government hospitals are doing free services, how come consumer court is accepting those cases in the consumer court?
See, one of the things is very clear. There is a very clear-cut set rule for this. If you are not taking any money from any of the patient, it's not that this particular patient you are not taking, so he would not be consumer. If you are not taking any fee from any of the patients, all the patients you are doing a free service, then you would not be under CPN Act. But if you are going to take any money from any one of them, the government hospitals are coming under this one because they are taking some subsidized 5 rupees, 10 rupees for X-ray, 20 rupees for the rooms and all that. So anything other than the token registration money for a single time, if it is there, then they are under the consumer court. Fortunately, there is a myth that the government hospitals are not there under this one. So there are not so many cases. Otherwise, there should have been a tsunami of cases against them.
No, but Dr. Lalitha, and I think Gaurang will agree with me, that whenever government hospitals are charging money, actually they are not giving receipt that they have charged for the registration, but they are actually giving the receipt as the donation. And that is what I know in Sion Hospital also, when they were charging 10 rupees for indoor cases one-time admission, the receipts were in the form of the donation to the hospital or poor box fund or something like that. So strictly speaking, when you take it as a donation, you are not charging the fees, and that is how most government or municipal corporations are doing it.
No, Ravindra, I understand what you are saying. Single time registration money, whether it is a registration money or donation, is no issue. The problem is that there are certain private rooms. Okay, you may be charging 50 rupees, 100 rupees rather than 2000 rupees, but you are charging them. For the X-ray and CT scan and all that, it will be very subsidized vis-a-vis the private ones, but you are charging money. So they fit into the Consumer Protection Act as per the rule. That is the situation. And like I said, it is a myth among the doctors, and fortunately the patient and attendants also like this. That's why there are not so many cases. There are few cases, not so many as otherwise would have been.
Okay.
Gaurang, one thing is,
Please.
like in JJ hospital, like in government, there are no charges. Even for the registration, there are no charges. Only in the municipality. Now, second thing is, I was just searching. I was just going through the new amendment. So in that, somewhere it was written that if for the health services, if there are no charges taken, then they should not be taken in consumer court. So I just want to find out it, but I'm not able to get it. So there is something it is written in service. So now we have to wait for the new one. Old one, it was directly in the CPA, and whether you are charging or not charging, doctors were included. So this is a
Right.
little tricky. We have to find out. If I get
Right.
that order, I will just forward it.
Right. Sunil, you want to say something?
Yeah, I agree with this only that whenever you charge any services for you charge for any services, you are falling in CPA. Except registration, nominal registration charge for first time or single time. Whatever charges for X-ray, sonography, or any procedure, or any special room, or any kind of charges are taken from anybody, any patient. That means you are services is you are charging services and you fall under CPA definitely.
If you take that charge as a donation, then obviously you are not going to fall into CPA.
It is one when you can have an excuse. If a donation is there, it is not considered to be charges.
Why I'm saying is that when I was working in Sion Hospital, all the charges, they were of course in nominal 5 rupees and 10 rupees, they were just nominal charges. But I clearly know that the receipts were given as the poor box fund. So that is how they were doing. So if you are taking the poor box fund, then obviously there is no charge. But as Bhai rightly pointed out, that although in Sion Hospital everything was like this free, but there was one paying ward where people used to pay for the stay and other thing. But out of those 1,200 or beds hospital, it was only 20 beds.
No. Khalas, Ravin bhai, gone. It doesn't work. It doesn't work that way.
Gone.
That is gone. That means even every year you take one room, one single patient, you take 5 rupees extra.
Then
all the patients are included. All the patients are included automatically.
Means you are charging services. That is true.
Right. Okay. So I think that was a good clarification on this aspect, and the situation still remains unclear unless and until I feel the IMA or some association or somebody has to go into the court seeking a very specific clarification as to what does it mean that not included in the list of the Consumer Protection Act. Unless and until that clarity comes in, we need to assume that all of us are under the CPA Act. And as all of you have rightly pointed out, that although government may give some eyewash or they may create some euphoria amongst the doctors that they are not included, but inside nobody wants to remove doctors from the CPA Act. And as you said that there are so many frivolous cases which are going on, but I don't know how much the government or the court will agree for that. So that clarification certainly is needed. This has really created a lot of confusion. And it is nice that all of you have clarified this particular aspect, because this was not clear, and now at least we got some clarity. Well, now we come to the third aspect, which is now very, very important. And why it is important? Because indirectly, all of us are affected with this third aspect. And let me just share this screen with you and give you the background to the audience. Now, are you getting my slide?
Yeah. Clearly.
Now all of us, we know that since the pandemic came in March, slowly the private hospitals were acquired by the municipal corporation or the government, whoever body was there in the thing. Gradually, this acquisition came to the tier 3 city also. And then even smaller nursing homes, 20-bedded, 25-bedded nursing homes, individual nursing homes, were taken up by the authority, the municipal authority, stating that there is a need for the hospital under the Pandemic Act. You could not say anything. Now the problem is that apart from the acquiring the hospital, now the authorities actually gone beyond, and they have started putting the limit, because there are certain people who have complained to the municipal corporations that for the non-COVID patient, now obviously how this non-COVID patient can complain, but they complained that this they were charged very heavily. For example, a person who is admitted for the myocardial infarction, he was treated, and the bill came so and so. And these patients, they go to the municipal commissioner and say, "We are asked this," and then commissioner says, "No, you give concession, or there is a cap. There is a limit to which you can charge on the non-COVID sort of a treatment." Now, first and foremost, do the hospital or authorities have the authority to dictate terms to the how you will treat non-COVID patients, how you will do any other thing, how much salary you will take, how much salary you will not give, so many other things. Do they have that authority or not? There are so many questions which have come into the place. I am just giving this particular this which came very recently, few days back. The High Court stays, and this was a very great relief to all of us. PMC is the Panvel Municipal Corporation. This particular news came in from the Panvel Municipal Corporation, wherein the patient was admitted. He was for the non-COVID treatment. Patient was charged certain amount. The patient was somehow related to the municipal commissioner. He complained to the municipal commissioner, and municipal commissioner became very aggressive, and he said that how you can charge this much, you give concession and this and that. Eventually that there was a lot of uproar, and the obviously hospital authorities paid, but the matter went into the court. And when the hearing court was done, the obviously the judge was very furious against the commissioner's act of irrationally asking for the concession, telling the authorities to reduce the bills, and asking what he is charging about the non-COVID patient. And what they said, what the judgment said, that senior advocate Anil Adurikar, advocate Vishal Thadan from the hospital argued under the Epidemic Disease Act, the only power vested in the civic chief and the state is to take preventive steps to contain the spread. They said the power of adjudication is not vested in any authority except the court. So this was a great relief that the court heavily came to the municipal authority, stating that you have gone beyond your limit. You cannot do all these things. So I want clarification from you. In fact, there were a lot of cases. All of us, we know that Sadashiv Bole had a lot of problems. Many of us, we know that our friends have gone into a lot of problems. Now, what I want to ask you specifically, starting from Dr. Lalit Shah, is that does this pandemic law makes the civic administration a dictator? Do they have that all these rights, or it is only the hype which is created? Actually, they don't have any authority like that. But under the Epidemic Act, which we really don't know what details are, they are behaving like a dictator. Is it really true? I want to ask Dr. Lalit Shah.
Yeah. Hey, what happens is that the pandemic law, if you go through this is a 123 years old law, and there are very 4 sections only, which will probably come in one PPT only. First one is to talk about the act. So that is insignificant. The 4th one says that it provides the immunity to the other people whosoever are acting under this. So there are only 2 sections into that, and that this says that to limit the spread of the disease, they have given them the rules to make the new rules and regulations, so that they give the power to the administrations and the government or the health authorities and all that. Along with this, along with the Disaster Management Act and Emergency ISMA, Emergencies Medical Services Act, what has happened is that the absolute power is handed over to them. And then obviously, when the absolute power is there, there is always a possibility of overuse or misuse and all that. And another aspect which happens is that they are going beyond many things at many places. For many things, they are going much beyond the rules and regulations and their limits. But who is going to take panga with them? That becomes the basic problem. That remains the basic thing. Because once they say, for example, for this particular act, the situation may change, but they may come out with some other things under your pollution control board issues, your fire act, and something or the other. I can tell you one of the a very simple example. In one of the areas in our area, Chhattisgarh area, the not maintaining the social distancing, they fined 2 lakh rupees to a sonography machine for a sonography clinic, while the patients were outside the street. To maintain the street is not the department of the doctor, but they fined him 2 lakh rupees, ultimately settled onto 1 lakh rupees, and for which they took the donation in the name of Red Cross, 1,000 cash. That means everything was sort of illegal, but they done, and then ultimately by force they asked him to write it was a donation, and that doctor also unfortunately had to yield in. It is the situation like this. They
No,
are
what
going
you are
beyond.
saying,
The only option available is to go to the court.
what you are saying is very, very true, and this is what actually is happening to many of our friends. And Sadashiv Boy also suffered in the same way,
Yes.
that they are going beyond their limit. But there are certain people who have actually gone to the court, and court has come very heavily now in this. This is a small Panvel Municipal Corporation, very small body. Now that commissioner also became very authoritative and sort of a dictator. But then court has said that is it become the police state? Now how can you do all these things? It is not. It is beyond your limit. Now I want to ask Dr. Gaurang Shah that what authorities actually the commissioner or the government, whosoever is in charge, gets it. Now, obviously, we can challenge them in the court, but as Dr. Lalit Bhai said, that if they are the authority, and if not from this, they will take some other steps in which they will try to prosecute you. So, what is the solution of this?
Yeah. So if you go to, as Dr. Lalit Shah said very rightly, there are only 4 paras in that. But if you go to see that the central government has got a right to make any law at that time for the pandemic. So if they have made the law that, you know, we have to give that 80%. So in Mumbai, it is like that 80% of the beds for the COVID is according to their charges. Means if the patient is in ward, you have to charge only 4,000 rupees per day, inclusive of everything. Then if he's in ICU, then not more than 10,000 rupees. So all these things are for 80% of the bed. And for the 20%, it is as per the hospital norms. So as you said very rightly, 2 hospitals already they have said in Mumbai that we cannot afford and we are going in heavy loss and we will close it down. And this is the one in Gujarati which is says Prashashan koi hospital band karavi na sake. Means just by giving an order that you have done a wrong thing, they cannot close it down. It is not possible. So they have to, even the law is there, and even if they find out that something wrong has happened, they have to go step by step. They just can't take it for granted and they close it down. They have to prove that they have taken extra charges or they have not followed the norms.
So this is what I want to ask you clarification, that this is exactly what you have described is happening, that the hospital is not ready because they have no income, so their income has gone down, so they are giving the salary, they cannot give salary, and the authority is saying that you cannot, your people, they have to come for work, and you cannot close down the hospital. Now where you go, where can this be challenged to the in the court of law? Is it possible that you go to the court and get the stay order? Sadashiv Boy did the same thing, and at least they got the stay order because they were unnecessarily charged very high fine and penalty, and court has given a stay. So how the court looks at it?
No, there are 2 aspects. One is the making of the law. You can't go to the court because it is by the central government or maybe by the state government. So they have, in this pandemic, they have decided this is a law. This is like you cannot charge more. You have to give your hospital 80% bed. So you can't go against them. So that is
No, but
one part.
if they make a law which violates the basic right of the person, then obviously it becomes the constitutional matter, isn't it? Because if I am the owner of a hospital, I want to close it. Now, who is the authority to tell me you cannot close it? Now, is it not the basic right which is given by the constitution? Now, can we challenge from that angle? Can anybody challenge from that angle? Because now everywhere we are seeing that the local civic authorities, they are crossing their limit. This has happened everywhere, and many of our friends, urology friends, have suffered, and I'm sure many other branches people have suffered. So, what is ultimately the solution? Do we just accept what they are doing it, or we there are ways and means to find out some solution under which we can at least approach the court?
To be very frank, I don't have any idea, because otherwise these two hospitals, which are very renowned hospitals, only they, they would have gone to the court, or they would have gone to somewhere, and they would not have appealed them that we are in loss and we want to close it down. So I don't
Right.
think it is possible. Otherwise, they also have got a big lawyers to help them out.
Correct, correct. So this is what the dilemma which we really don't understand. Sunil bhai, you want to say something? Yeah, you are muted. Please unmute.
Unmute.
Yeah.
Yeah. Again, you are muted.
No, you have to unmute.
Bas.
Okay, now,
Yes,
Yes.
Yeah, okay.
okay.
Yes,
Yeah.
okay.
See, if non-COVID hospitals are there, and they are the cap of charges are these people are putting these caps on the charges, that can be challenged definitely. For COVID hospital, this can you hear me?
Yeah.
Yeah, everywhere.
So for COVID hospital, now what happens? This act, Epidemic Act in 1897, it is a central and state government's act. It is empowers both the central and state government. And specifically, act is meant for the state governments. And it is they can make a temporary regulations. State government can make a temporary regulations for the public or class of the persons to observe. The regulations mentioned above have been enacted under section 2, 3, and 4 of this act. So these are temporary actions taken by the authorities of state governments, and that has got a stipulated time for which they can be implemented. Otherwise, that will be over after a certain period. The Epidemic Act is over, implementation is over. The implementation of this regulation is over. Now, this also can be challenged if it is unrealistic things are done by the state government. It also can be challenged, as far as I know, and you can go into the court of law. This is what I know.
So in that case, Dr. Lalit bhai,
Yeah.
what Gaurang said actually is true, because many times we have seen that even the major hospitals, even those hospitals which are actually doing well and they have all resources, they have also kept quiet. So what is this? Is it not something which is puzzling all of us, that we think
No.
on one side that this is quite easy to challenge? Why can't we approach the court, and why not the hearing take place? And at
There
least
was no.
have some clarity. But many hospitals, they have kept quiet and they have accepted what the authority has said. Some of this have challenged, and court has actually given them the relief, as you can see here in Panvel case. The court has very clearly said that you cannot dictate terms. You have to restrict yourself only to the spread of the disease. You cannot cross your limit. This is not a police state. This is what the judge said.
I entirely agree with you. What you are saying is, see, what happens is that the law is a matter of interpretation. Again, the act per se, like you said, it's a very, very small few line act only. And what is happening is that it has given enormous power to control the spread of the disease. Then everything can be translated and speculated into that. Like in Mumbai, like Gaurang Bhai is saying, taking over of the 80% of the beds for COVID beds. So that would be very difficult to challenge, because that is to control the spread of this one. That can be interpreted into that. And for that, because every patient is not able to afford that much of this one amount, they can put the limits to that. But as far as the unnecessary fine for the non-COVID situations, unnecessary charges for the non-COVID procedures, that is not justified and that can be challenged. Acha, in general, what happens is that nobody wants to take any panga. So generally speaking, this is a matter of large perseverance that you want to go to the court. Everybody does not have the willpower to go to that. That is the situation.
I want to add something. At present, I am a medical superintendent of 410 bed hospital, general hospital of my district. Here also we are having regular meetings with district collectors and even the additional collector and all the different varieties of officers. And in that also we find certain things. They will force us to do certain things. For example, one example only, we have got a medical college here, and out of 8 PSM faculties, 5 PSM faculties of 5% of these PSM faculties have been taken away by them only to just provide the data. And we cannot do anything. Once they say that this is to be done, it is to be done. So we have to follow that, and we are following that. So this is...
These are the authorities. This is the authority which they have taken. Now, one question which I want to ask you is that when the government takes up the hospital as a COVID hospital, and the employees have to work as per the whatever COVID norms which they are putting in. Now, what happens is that there are some people who wish to remain away from the duty, citing whatever, whether it is genuine or it is not genuine. Now, is it possible? Now, what I have seen and what I have heard is that once the government takes up as a COVID hospital, all the employees they are actually under the district authority collector or whoever has taken up, and you are not allowed to take any leave. Any person is not allowed to take leave. People who have remained absent, the government has lodged the FIR against them, that they have remained away from the duty, and they would be lodged a police complaint. Now, Dr. Sunil Bhai, what is situation in your hospital? Since your hospital, COVID, someone wants to remain away.
There is a circular from the government of Gujarat itself that all vacations are cancelled. And even leaves are not sanctioned unless and until it is a dire emergency. So I am also not allowing anybody to take vacation. In a few cases we have done, but they were in a non-clinical branch. And as far as this thing is concerned, that action to be taken by the epidemic on the Epidemic Act ground is also, it was there when it was a first meeting on 22nd March of 2020 with CDMO, and we were all professors and associate professors and head of the department were sitting in front of him. And everything was going smoothly. He said that government has given this money of this SOPs and all this thing, and we have to make this 126-bed COVID hospital in General Hospital Palanpur. So we vacated our first floor of the whole old building and dedicated 126-bedded COVID hospital was formed, out of which 20-bedded ICU was there. And everything was managed by us, and we prepared everything. And the CDMO was telling in the meeting that, okay, everything is okay, now meeting is over. But at the end of the meeting, he said, if you don't work, Epidemic Act will be defeated. So I got little bit frustrated. And I was little agitated also. I did not speak anything at that time. But next day morning, I sent a WhatsApp message to the district collector that any kind of threat of this kind will be not tolerated by any one of us. And when we are doing work with a cooperation, and we are positive in helping the government of Gujarat, and when we are not showing any opposition for any kind, then this CDMO should not give us a threat of Epidemic Act. And I wrote in a very strong way by WhatsApp only. Immediately, district collector called me that, doctor, what happened? I said that this is what he said, at the last while summarizing this meeting, and I am totally against this thing. Any kind of threat cannot be tolerated by any of us. So district collector called him and told him not to say like this, and he withdrew his word. So this is what at present happening here in my place.
So basically, they have the powers to.
Ravindra, I will tell you one thing. Like in Mumbai, they are not taking away the hospitals. They are forcing them that you make 80% of your beds, like you take 50% of your bed as a COVID, and out of that 80% should be as per the GIPSA, or it should be as per the municipality or government law. That it is your lookout. Who comes for the duty, who doesn't come, because in our institute there are many people after 2 months, 3 months they have resigned, and you cannot stop them.
Correct. That is what I want to know.
Yeah. So unless and until, yes, the government or the municipality is taken over the administration, then there will be problem. Otherwise, it is a problem of administrator of that particular hospital.
Correct.
They have to give the
Absolutely.
result. They have to give the result.
I entirely agree, Gaurang bhai. What you are saying is, let us be very clear in our concept. Number one, such situations have to be managed with the interpersonal, our whatever relationship that we can have. That is number one. Once we feel that the water has gone beyond our head, we have to go to the court of law. Number three, municipal corporation and all that. Nobody is going to take this hospital and take care for the administration and all that. They don't have that much time and the manpower, so they are going to force you to do that. Okay, yeah, well, you give 80% of the beds and then you run the way you are as per our guidance and our instruction. That's all. We would just supervise and see to it that you don't go beyond the board. That sort of thing. They would not take over and take care of all these things because they don't want to take headache. They don't have manpower.
Government of Gujarat has done this thing, MOUs with all private hospitals, and in that MOU, empty beds, if the beds are not occupied by any patients, some charges are given to the hospital, and those beds are occupied with less severe conditions patients. They are giving certain amount per bed, and the patients, those who are admitted in ICU, for them also separate charges are paid by the government of Gujarat to these hospitals. So this is MOU done by the government of Gujarat with all private hospitals, those who are made Covid hospitals.
Right.
But they have not been taken over by the government.
No.
Yeah, that is what I'm saying. That the management, why the government अब कहाँ से बना सिरदर्द पालेगी इतना सब possible नहीं है उनके लिए.
They have kept charges for this COVID hospital. Charges they have made it very stipulated charges are there.
Yeah, fine.
Dr. Gaurang, I want to ask you that when the government is taken over your hospital as a COVID hospital, and you are being managing with existing staff, whatever 80%, whatever is that. Now, slowly, people have started taking leave. They have resigned. Now, you are come in a situation where now you cannot really run the hospital with the very, very few staff which is left over. You cannot prevent people from resigning. Now, you tell the government that we are unable to provide the services. You take away this COVID hospital. What happens in that situation? We are no longer, it is no longer possible for us to run the hospital.
Yes. See, now.
So, in fact, we are refusing to be a COVID hospital.
See, initially people were afraid. Now people have realized that there is not much of the problem in working in a COVID hospital also, because they are given for proper PPE and there are very few cases where they have got infected. So now what is happening is that the newer staff, who is a junior one, they are willing. There are so many people who are without work, and that is the reason people are coming and they want to work.
No, that's okay. What I'm asking is the legality, that in case if people have left out and you want to say that now I cannot run my hospital, please take away this COVID, I cannot run it. Is it possible for you to tell that?
No, it is not possible. Once they have...
On one hand, you have no staff, and how can you run the...
No,
I think it will be possible. I think it is possible. There is no issue, because if you cannot do that, you can write to them that XYZ reasons that we do not have the staff, they are going away. These are the situations.
Dr. Lalit Bhai, why I'm asking is that what Gaurang is saying is true, because what has happened here in Ahmedabad, one of our friends, that he said that there are many people who have left, they have resigned, they are no longer coming, and therefore we cannot run this hospital as per whatever your norms. So please allow us to stop this facility. What government and the district collector and they said that those who are not coming, you give the list and we'll put FIR on their name. They will lodge FIR against those who are not coming. Now, what is the solution to that? They are going to that extent. So, what is the solution to that?
I will tell you something. I want to add one more thing. According to the Section 3 of Act, any person who disobeys an order or regulations made by the government under Act shall be punished with in accordance with the section of 188 of the IPC 1860. In that 1 month imprisonment and 200 rupees fine. And if it is continuously doing it, then 6 month imprisonment and 1,000 rupees fine. Another section is 190 and bailable. And IPC 195 in CRPC, public officer can file a complaint. So any district collector or any CDHO can file a complaint against you, and it can happen. So another section is 269, 270, and 271. Punishment for negligent action, that is a different thing, but here 188 falls in this section for those who are disobeying the regulations which is formed by the district collector.
So, that is what I'm saying. It is sort of a management that you have to, interpersonal management. Otherwise, it is difficult. They have a power and they can go to any extent.
Yeah, so that means legally speaking, they can lodge FIR and they can make you to come back and work even though you want to resign. So this is what is the overcoming the basic rights. So what basically means is that with this Epidemic Act, the basic rights also are being violated, and we really don't know because this is the first time in our life, at least, we have seen this Pandemic Act, which is being implemented. And there is no clarity unless and until we go to court. And going to court, we know that how hazardous it is. It is better to have corona rather than going to court. It is easier to. And these are the problems which actually people are facing. So with this, I think we come to the end. I think we had a lot of very free discussion, very frank discussion. These three issues, which mainly I wanted to discuss it out, and all of you have given a very, very clear answer. There are issues which really have no answer, and you have rightly told that there is no answer to that. Whatever we have to follow, we have to follow. But basically, we have understood. I think audience has really understood what exactly means, whether we are under CPA or not, what is Pandemic Act, and what is the clarity about the consent. Once again, thank you very much for sparing your time. Thank you very much for participating in this webinar. Thank you very much for preparing the questions and answering with such a good clarity. So with that, I thank all of you and say you goodbye. Thank you, Dr. Gowda.
Thank you, all of you. Bye-bye. Good night.
Thank you.
Bye.
So
very
much.
nice. It had been a pleasure.
Yeah.
Thank you. Thank you. Thank you. Thank you.